All right, so in this one, we're going to be talking about the initial evaluation procedures and some of the things that we need to make sure that we're documenting as we go along and do the initial eval. So the first thing that we should pay attention to is the initial evaluation checklist, which can be found on the shared drive under the checklist folder. This checklist is going to contain a multitude of different things for the therapist to perform, but also for the front desk to perform. So if you go there, you're going to find that the first thing on there is going to be the therapist responsibilities as it pertains to the initial evaluation. So the first thing that we're going to be looking at is, does this patient need any new equipment? So this is where we're talking about wheelchairs, standers, gait trainers, canes, walkers, beds, whatever it is. Even if they need a ramp to get into and out of their house, or a van, some kind of medical equipment, we should be writing it down, because there are organizations that we can contact to try to get funding for something like that. So make sure you're just taking note of all the different accommodations that the patient could need to better their lives at home. So the next thing it talks about is the frequency of visits. So in this checklist, you're going to check off the frequency of visits that you've talked about it, and then you're also going to write in the number of visits that the patient's going to have. So if they're 2 times a week, then make sure that you're discussing that with the patient and talking about the commitment that's required for them to come 2 times a week. So it's a medical plan of care. So we should be talking to the patients, and before we agree to a frequency, we should be talking about, John, this is going to be a commitment. I feel like we could really help you, but in order to see the progress that you want on goals A, B, and C, we're really going to need to see you X number of weeks, 2 times a week for an hour, 3 times a week for an hour, whatever it's going to be. Just make sure that we're expressing the need for that commitment. This is a very competitive program. If we put you on for 2 times a week, then you're really going to need to be here 2 times a week. It's incredibly important for you to see the progress that you want. And it shouldn't stop. It should just start at the initial eval, because then after it, we need to constantly keep John updated on his progress. Hey, John, your goals XYZ are coming along very nicely. Just keep on pushing at it. You're coming 2 times a week. You're making most of your appointments. You're seeing goals. Do you see the progress that you're making? Do you see why this commitment is so valuable for you? Those are the kinds of things that we're talking about, and it starts at initial eval so that we can see Johnny coming 2 times a week. And then it makes the front desks their job a lot easier for that patient when they call in to change an appointment or cancel an appointment. They know they're committed to this program and that they have to be here 2 times this week. Even if they're canceling one of their appointments, then they already are thinking, oh, I'm going to have to reschedule this appointment, not just cancel it, So the other thing that we're going to be talking about with that checklist is that we've discussed the cancellation policy with the patient. So they should know the cancellation policy very well by the time they leave the initial eval. And mainly we should be getting across the point that, look, things happen. We know, that Johnny, you have MS, and some days you're just going to wake up and you're not going to be able to get out of bed. All we ask is, please give us at least 24 hours notice so that we can get somebody else in. If you can't do that, then we need to reschedule that appointment, or you will get a $50 fee. So we just need to make sure that we're being very clear and communicating to Johnny that that's our policy. And then again, the front desk will, and then they'll also sign something so that there's no surprise when Johnny calls in within 24 hours, cancels, and then gets that $50 fee. The last one is that the patient's plan of care system has been started. So the way that we monitor those plan of cares that you guys will see in the other module, the plan of care system module that we have, we need to make sure that system has been started so that the doctor is getting that referral or the plan of care, and that he gets it signed and that we get it back so that we're in compliance with Medicare and all the other insurance companies. So those are the therapist responsibilities. Then it goes back to the front desk, and the front desk needs to make sure that the patient's been tagged in Active Campaign with an appropriate tag of active patient, Westminster or wherever, that patient's at after that, and then that the patient's received a quality control follow-up phone call. So every time we have an initial eval, 24 hours later, we're following up with that patient and seeing how the visit was. Did you like, Mary, your therapist? Was it an enjoyable experience? Would you recommend a friend? That kind of a thing. And then the last one is that the front desk has started the authorization process, so that if we need authorization before the initial eval, obviously it's going to happen. But sometimes we see the patient on initial eval, and then we need to request authorization after the initial eval. So that needs to make sure it happens after that. So, so this checklist, we just need to make sure that every patient that we see, you're checking off all the things, and then you hand that paper over to the front desk, who then takes care of the last couple of things. So.